It's now my distinct pleasure to introduce today's commencement speaker, Dr. Christopher Lewis. A native Texan, Dr. Lewis graduated magna cum laude from Southwestern University in Georgetown, Texas in 1999, earned his MD from us in 2003. He went on to complete his residency training with the Waco Family Medicine Residency Program thereafter. Since graduating from UTMB, Dr. Lewis has continued to care for communities and serve their patients here in Texas, working at the Brushy Creek Family Physicians Group Practice in Round Rock, Texas. Dr. Lewis also helps medical students and residents across the country become better physicians because he's chief educator and production manager for Doctors in Training, which is a major online education company. In his role at Doctors in Training, Dr. Lewis has created, edited, or taught hundreds of lectures. He's co-authored Step Up to USMLE Step 1, as well as the third edition of Step Up to the Step 2 examination. Along with a team of videographers, medical editors, and graphic artists, Dr. Lewis uses unorthodox methods to bring comprehensive board review courses and courses on subjects from anatomy to pharmacology to life. Many of you may have actually seen some of his videos and watched his lectures on your computer screens. He believes that laughter is important in both teaching and medicine. And he also, I think, believes that learning to take yourself less seriously is an integral part of success. He infuses his work with humor. In his spare time, Dr. Lewis gives back by volunteering his services through the various health ministries. These are faith-based, non-denominational, nonprofit organizations that provide health and wellness services for uninsured families in Williamson and Travis counties. So class of 2015, ladies and gentlemen, please join me in giving a warm welcome to Dr. Lewis.
Thank you very much. That's very kind. I have to warn you, I'm a loud person and very excitable, so watch out. Thank you to all the UTMB administration, faculty, parents, grandparents, everyone else here to celebrate this momentous day. And of course, most importantly, thank you to the 2015 School of Medicine class who invited me here today. Oh, it gets better. So, class of 2015, are you ready to graduate? Are you ready to graduate? Not so fast. A 27-year-old man is involved in a motor vehicle accident. He complains of shortness of breath. A chest x-ray reveals a collapsed right lung with a shift of the mediastinum to the left side. Class of 2015, what is the next best step in the management of this patient? You can yell it out. Eh? Well, did I hear needle decompression? Wrong! Collect the copay. I'm sorry, everyone, we might have to shut this thing down. I'm not sure they're ready. Always get the copay, come on. I had 49 more questions. I guess there's no point now. I know it might seem shocking, but this is my first commencement speech. When first asked to participate in this glorious event, I thought I'd get the job of handing out the diplomas. Seemed like a great job for me. I excel at handshaking and saying the word congratulations over 200 times. But come to find out, I'm expected to give an inspiring and thought-provoking speech. I hope you didn't get your hopes up. But I hear there's a reception afterwards, so at least there's that. Ooh, and maybe they'll have those little wieners with the toothpicks in them. I love those. But first, who am I? Why am I here? That wasn't rhetorical. I'm really not sure how these things work. I think this is the part where we get the lasers and the fog machine and the dancing bears. Are we doing that? Sorry. Ladies and gentlemen, I've just been informed there are no lasers. Not even one dancing bear. Well, let's start again. Who am I? Well, I'm an educator of sorts, but I don't have a typical classroom. I don't have desks. I don't have chalkboards. I don't even have any students in front of me. I do have a bunch of very bright lights shining in my face, a green screen behind me, and a video camera to capture my every word and action. Now, these videos are put up on the internet, and students watch them all over the United States and even overseas. But if I'm an educator, what do I teach? Well, a great deal of the material that's actually taught in medical school. For those in the audience that may not know, in order to become a doctor, a medical student is required to pass 3 very important board exams. Now, the Step 1 board exam is particularly difficult, and students will spend months preparing for it. And after those months of intense studying, students can get overwhelmed and even start to go a little bit crazy. This is where I come in. I work for an education company that provides board review courses that help students prepare for their exams. But that still doesn't really explain why I'm here today. Is it because I'm an amazing teacher? Well, and all false modesty aside, I'm pretty good, but nothing that special. Most of the faculty here could probably teach circles around me. I suspect the real reason that I'm here today is that I am a huge idiot. Again, shocking, I know. Before most of my lectures, I try to entertain the students with a humorous introduction, something ridiculous to lighten the mood. I've been a cowboy, an Egyptian pharaoh, and a hipster poet. I started my own cartoon called Lose Clues. I thought that was clever. I've been a 911 operator, and I've been slapped by my cameraman, Travis. I have taught a lecture on sleep disorders in my pajamas, and I've had an argument with my subconscious mind, who, by the way, is a jerk. So why do all this? Well, honestly, it's a lot of fun, so I do some of it just for me. But there is method to my madness. Studying for a board exam is awful. As I said before, you go just a little bit crazy after a while. Those intros are just little brain decompressions, just a 30-second reprieve from high-intensity, mind-numbing studying. And if the best I get is a roll of the eyes or maybe just a groan from a student, even that's still a tiny distraction from the stress of board review. So that's what I do for about half of my day most days. And in addition to that, I also have a typical family medicine practice where I see patients every day. And I'm also an associate professor at Texas A&M Medical School in Round Rock, Texas. So that's me. I'm an online teacher slash class clown slash family medicine doc in the suburbs. Okay, so now on to the inspiring part of the speech, which, without dancing bears, meh. Graduates, it's now time for the next step in your training. When beginning the first year of residency, many of you will feel nervous about your new level of responsibility. You are now writing orders and prescriptions and directly affecting the health of patients. All scary stuff. You'll be looking up everything from medication dosages to how many bowel movements a person should have in a week. More than one. And you'll also be afraid of looking stupid in front of patients. And all of this is normal. I was no different my first year. I felt like a fraud, that somehow I made it through medical school by an incredible stroke of good luck. And to cover my embarrassed ignorance in front of patients, I would use what I like to call the beeper save. If I was ever presented with a question or diagnosis that I didn't know, I would deftly reach over to my beeper, hold it down a button, and then that would produce a tone. And then I would say something like, "Did you hear that? That's my beeper. I guess something big is going down, and they need me." And then I'd strike the pose like this. And then in dramatic flurry, I'd leave the room, and then I'd go look up whatever I didn't know really quick. When I'd return, I'd say something like, "That was Dr. Oz. Yeah, the guy from TV, we're tight. He told me Oprah needed some help with her hamstrings. I gave him some tips." And then I'd answer whatever question the patient had originally asked, acting superior and intelligent. I know, pretty awesome. The moral of the story is that medicine is an ever-changing profession, and you'll never know it all. What was cutting-edge treatment one month might be malpractice the next. And I'm sorry to have to tell you this, but you never get to stop studying. But also, and probably more importantly, don't be afraid to admit that you don't know something. A physician that pretends to know everything is dangerous, and that type of arrogance can get you and your patients into big trouble. So be humble and willing to say, "I don't know." Next story. Again, I'm in my first year of residency. It's Thanksgiving morning, and I'm in the newborn nursery during my pediatric rotation. My fellow residents and I are sitting around with the attending going through the patient list. Nothing too serious, but a baby who had just had a circumcision was having some persisting bleeding. We asked the attending if we should consult with urology early today because it's Thanksgiving, and one thing that doctors hate is a late consult on a holiday or weekend. Remember that one. But the attending says, "Nah, we have a few interventions to do on our own first." Perfectly reasonable. So, of course, the bleeding never stops, and now it's mid-afternoon, and my attending tells me to consult the urologist on call. Oh, now I'm worried. And I admit I have a bit of a wild imagination, especially when I get nervous. So let me tell you what was going through my mind while I was dialing the number to page the urologist on call. This is completely made up. Dr. Urologist is on call Thanksgiving, but it wasn't going to get him down. His grandmother from Sicily has flown in to cook the family her famous turkey surprise. And even though they don't have turkeys in Sicily, his grandmother magically became world famous for her special 3-day brining technique. I hear that's a good way to make turkey. So he wakes up at 6 a.m., which is amazing because urologists usually don't wake up before 9. I'm kidding. Usually it's 10. But he wakes up at 6 and he goes to the hospital, and though it takes hours, he sees every patient on the census. He rushes home, and everyone is at the table waiting on him. His grandma smiles and hands him a plate of piping hot 3-day brine turkey. Maybe some yams. He seemed like a yam guy. He puts the fork up to his mouth and then beep, beep, beep. So that's what I'm thinking as I page the urologist in the mid to late afternoon on Thanksgiving. I'm prepared for the worst tongue lashing of my life. But you know what? I get on the phone, and it wasn't at all what I was expecting. It was way worse. He was furious. First, he told me where I could stick that consult. And then I think he even invented a few curse words. He explained that he had just left the hospital, had just sat down to eat turkey with his family from out of town. I asked if the turkey had been brined. He didn't think that was funny. So what's the moral of the story? First, respect your colleague's time. We're all on the same team here. Dr. Urologist had every reason to be upset with me. Medically speaking, our team really didn't do that much wrong, but we didn't respect the time of our colleague, and that's a big deal. Go out of your way to accommodate your fellow doctor. Second, be nice. Yelling and throwing a tantrum is never the right thing to do. When training to become a doctor, you frequently find yourself on the bottom rung of the power ladder. There's always a medical student, a resident, an attending lording over you. And after a decade of bowing and scraping, you finally stand atop the heap. Well, what should you do with such power? Nurse, bring me my coffee. Patient, take these pills. Oh, I wanted a blue pen. I'll get that later. Maybe some of that was socially acceptable in the past, but not so much now. I believe that grouchy doctor routine is counterproductive. No one looks at that behavior and says, he yells because he's just so smart and demanding, and in the end, it's really good for the patient. Instead, they say, that guy's a jerk. I don't want to help him at all. I'm going to spit in his coffee. So do yourself a favor, be respectful. This also applies to how we treat our medical students. I know it doesn't happen here at UTMB, but in some medical schools, the attendings and residents pick on the medical students. I know what? We teach that compassion, sensitivity, and kindness are all critical qualities that every doctor should have for his or her patients. But our actions toward medical students are sometimes more akin to a playground bully. How can students hope to cultivate any empathy for patients when they're being poked constantly with sarcasm and negative criticism? We are not toughening them up, and we are not making them better doctors. We're just really making them more cynical. Therefore, we should practice what we preach. Be nice to your future medical students. Okay, final story, I promise. I'm in my 3rd year of residency. I'm running behind in my clinic, and I'm on my last patient of the day. I rush into the room without looking at the chart. I don't sit down. I immediately launch into my exam, and I start firing off questions. What's going on? Does this hurt? What medications are you taking? And throughout my interrogation, the patient refuses to answer any of my questions. He just kind of looks at me and smiles. But he doesn't look mad or irritated with sort of my busy manner here, so I move on and I rush through a mental status exam while performing a fundoscopic exam. Or at least pretending to do a fundoscopic exam because I still can't see anything with that stupid scope. Again, no response from the patient, just a smile. There is definitely something wrong going on here. Does he have a brain injury or some intellectual disability? Or maybe he's got a brain abscess from some super rare parasite. For the first time, I sit down and I face the patient. I explain in simple terms that I'm worried about his mental state and that we need to get an MRI stat to look at the brain for any pathology. His smile fades, which I took actually as a good sign because maybe he now knows what I'm talking about. He then says, I am deaf. I'm just here for a sore throat. Are you really my doctor? I'm stunned for a moment, But rather than admit my mistake, I deftly move my hand over to my beeper without thinking, and I say, "Do you hear that?" After reading my lips, he says very slowly, "No, I'm deaf." All the while looking at me like I'm the stupidest person on the planet. At this point, a doctor of any substance or professionalism would own up to his or her mistake and apologize and just start over. I decided to run out of the room yelling something about Oprah's hamstrings. So what's the moral of the story? Well, you know you haven't reached rock bottom in medicine until you fled a room while yelling at a deaf man. What else can we learn? As you progress through residency, you'll begin to develop skills in the clinic and in the hospital, which will allow you to move very quickly through patient encounters. You'll become a diagnosing machine, and you'll quickly notice that patients will slow you down with unneeded information and bizarre questions and notions. You'll have to explain to Mrs. Smith for 15 minutes that no, her cat, Miss Twinkletoes, is not causing her hemorrhoids. So to combat this, you'll start to direct that patient during the history by gently guiding them through that pertinent info. But there's nothing wrong with that. However, if you're not careful, you can slip into some very bad habits. Instead of gently guiding the conversation, you cut the patient off. Instead of looking the patient in the eye, you start typing in the computer. Instead of explaining what's going on in simple terms, you spout off some medical jargon and then hurry out the door. And before you know it, you're one of those doctors that's always in a hurry who never seems to care. And you didn't even choose to be a quote-unquote bad doctor. You just got busy. And that's how insidious this is. None of you are going to wake up someday and say, "Today is the day I joined the dark side." None of you are going to say that. Except for maybe this first row of graduates here. I'm not feeling it here. Maybe something evil. That cane is menacing. I don't know. I'm sorry. I'm kidding. The moral of the story is that you have to slow down. And this is a very hard thing for doctors to do. I fail at this constantly. There's a lot of work to do and not much time to do it in, but slowing down will make patients appreciate you more, and you'll also make fewer mistakes. Most mistakes occur when you are distracted or running behind, and always watch out for the last patient of the day. There's always something weird going on with that one. All right. Now it's the time in the speech where we have to talk about something serious and heavy, but I promise we'll have a happy ending. A survey, I'm getting deep here, survey from Medscape and WebMD from 2012 reported that only 54% of current doctors would choose medicine again as a profession. You heard that right. Only about half of us out there would choose to be a doctor again if they had to start all over. And yes, I realize it's probably uncool for me to bring this up in a medical school graduation. But now you know. So why aren't we happy? We doctors complain about working too hard, about getting paid too little, and a bunch of other stuff. But let's talk about this for a minute. Let's tackle getting paid. Important stuff. This issue makes some physicians very angry, and though a lot of that anger is justified, I believe this can, in my opinion, lead to significant unhappiness. I actually try not to think about money too often, and one reason for this is that doctors make a whole lot of money. I don't have to worry about paying my bills. If I want, I can buy the fancy blue cheese at the grocery store. I don't suffer even a little bit in this life as a result of money. But then why is this such a big deal for some doctors, and why does it lead to so much stress and dissatisfaction? I think some of this I can answer with some advice my father gave me when I was a boy. Chris, it's not how much you make, it's how much you spend. He kind of sounds like Clint Eastwood. When you get out of residency, don't buy a mansion and a Lamborghini. I know they're cool. Buy a reasonably priced house, and I don't know, drive a Mazda. They're nice. Life is more expensive than you realize. I have 4 children, and though I try to convince them otherwise, they demand to be fed every day. I know, selfish. Don't overspend too early in your career, or ever for that matter, because if you do, then you will have to pay attention to every paycheck and every insurance change and every billing mistake and every government intervention. And that's when the business of medicine starts to eat away at you. So at the end of the day, you can get mad. that you're not making as much money as you deserve, and you're right. Or you can say, you know, I'm making more money than most of the people in this world, and things are actually going pretty well. But let's get back to the things I think are even more important. That survey said that nearly half of all the doctors in this country wouldn't choose medicine again as a profession. UTMB School of Medicine 2015, what are we going to do about this? Are you destined to become one of those unhappy doctors? Well, I don't think so. In fact, I think 100% of you are going to be loving your career forever, and you wouldn't think of changing. And why is that? Well, I'll tell you. Because you're going to take all this knowledge you crammed into your noggin over the past 4 years, and you're going to cram even more in residency and beyond. You're going to be humble and say, I don't know, when you have to. And because you know your medicine so well, you're not going to have to use that stupid beeper trick I told you about. You won't be as stressed or worried all the time, thinking that you missed a diagnosis or that you prescribed the wrong medication. That confidence is going to lead to peace of mind. Next, you're going to develop fantastic relationships with your colleagues and staff. Your coffee will taste better because no one is spitting in it. You will have each other's backs, and just knowing that you have help out there is going to fill you with a great sense of security. The next generation of medical students are going to come out more optimistic and willing to help you, because every time you see one of them struggling now, you're going to give them the support they need, and they're going to think you're a great teacher, even when you're not. And that's going to make you feel great. And then finally, you're going to look your patients in the eye and listen to what they have to say, even if they think their cat is giving them hemorrhoids. You're going to take the time to explain what's going on, and your patients will love you for it. And when your patients love you, they don't get mad when you make them wait for their appointments for a few minutes. They might even be more compliant with their treatment because they trust you more. And they may even forgive you when you make a real mistake. And sometimes when patients love you, they bring you cookies. And I have never been unhappy while eating a cookie. UTMB School of Medicine, class of 2015, with the possible exception of one row of evil doctors who I'm still keeping my eye on. Sorry. I expect great things from you. Not only are you going to be strong, confident doctors, but you're going to be happy. And that happiness is going to affect everyone around you. Enjoy this day. You deserve the celebration. Go forth, be nice, make friends, earn those cookies. I promise you won't regret it. I'll see you at the reception next to the little weenies with the Q-tip or the, whatever those things are. Thank you again for having me today, and God bless.
Thank you.
A lot to say.